All right. Good morning, everybody. This is the Anchorage Emergency Center update for the 13th of May. Just a quick reminder to everyone that this is being recorded. We will do a quick roll call. Taking a look here. Gosh, I wish I would have figured out how to. Sinosure Brewing, an Alaska chip company, is offering free COVID vaccinations today from 4 to 8:30, and another one of those nice incentives to try to get folks out and vaccinate. We heard on a meeting this morning that I think it's Ohio that's offering $1 million grand prize college scholarships. So a lot of creativity out there to try to get folks in and vaccinated. Luke, can we have an update, please?
Good morning. This is Luke Orrit, Situation Unit Leader here in the EOC. Today is day 435 of our response, and locally, up 187 cases, 0 deaths, and 2 hospitalizations. For 213 resource requests, we filled or otherwise satisfied 1,750, with 18 currently working. 28 non-critical transports in the last 24 hours, 2 of which were after hours. In the congregate sheltering sites, we've got 415 clients, up 9 since the last report. In the non-congregate sites, 315 clients, up 10. That's 730 clients in all shelters, up 19, averaging 2,190 meals served per day. Yesterday at the visit testing sites, there were 672 sample collections performed, and our vaccine numbers are temporarily unavailable. End report.
Thanks, Luke. Weather.
We are looking at a couple of nice days here, actually, for today and Friday. We got sunshine for the next couple of days. A little bit of southeast wind coming in on Friday evening, maybe gusts up to around 20 miles per hour, but nothing too significant. And then we'll be turning to more of kind of a cool, wet pattern for the weekend. Again, not looking at significant soaking rain, but at least a few showers on and off, and cooling temperatures more coming down from the mid-50s to the low 50s, and then continued cool and cloudy going into early next week on Monday.
All right, thank you. Weather. Operation.
Morning, everybody. This is Pat Ryder, Deputy Operations Section Chief. Today with Mass Care, our Q&I location has 13 projected discharges through Saturday. That's to include 6 discharges today. And just to reiterate, our warming tent has been demobilized for the summer. With public health, visit healthcare testing had a decrease of 1.18% over the previous Wednesday's sample collections. Our 7-day rolling positivity rate average is 1.26% as of May 11th. Our 14-day average reproductive rate is 0.846, and our 14-day average case rate is 10.31 for every 100,000 people in the population. With pop-up testing, we have May 15th at Muldoon Elementary School from 8 a.m. to 7 p.m. And this will be the final weekend of the Anchorage School District's pop-up testing. The hours at the Elmore testing site will be decreasing to 10 a.m. to 6 p.m. That'll be beginning May 17th. And Visit Healthcare will be adding Sunday testing to our Lusac Library location beginning May 16th from 10 a.m. to 4 p.m. With medical countermeasures, if you haven't heard by now, the Pfizer vaccine is now authorized for ages 12 and above. Parental consent is required for minors. Specifically, the presence of a guardian or parent is preferred at all clinics. However, it will be required at our Visit Healthcare locations. Today, on May 15th, we have pop-ups at the Alaska Club South, Spinard Food Trucks Festival, and Sinosure Brewing. Tomorrow, May 14th, we have a pop-up at the YMCA in Lake Otis and our regular clinics. This weekend at the Northway Mall, we have drive-through with Visit Healthcare, which will now be offering Pfizer with or without appointments. That'll be from 10 a.m. to 6 p.m. And the Alaska Airlines Center will be offering Pfizer with or without appointments from 9 a.m. to 6 p.m. We are currently preparing for the second dose clinics to follow up with the ones that were administered during vaccine week. Our medical countermeasures unit will soon be integrating into the Anchorage Health Department. And finally, our mobile vaccine clinics can come to you wherever you are, be it a church, a business, or other organization. So if you'd like to know more information or schedule one of these events, please dial 907-531-5100. Barring any questions in the report.
Thank you, Patrick. Logistics.
Hey, good morning, everyone. This is Scott Carpenter over in EOC Logistics. Here's our continuing lines of effort for mass care support. We are finalizing the requirements to shut down the Fairview Rec Center and return that over to the Parks and Recreation folks, as well as continuing our efforts to amend contracts and ensure services are in place for the summer regarding shelters and housing personnel experiencing homelessness. For medical countermeasures, we're continuing to support those second doses that Pat discussed through their second vaccine week, as well as the additional site locations for June. In other support, we continue to work staffing requirements both for EOC and AHD, and support the Northway Association events that'll go through the summer. I wanted to say a special thanks to Sarah Rogers as she departs logistics and goes back to Parks and Recreation starting next week. You guys will continue to see Sarah out and about serving the municipality in her other role with Parks and Recreation. So thank you, Sarah, for all the terrific work. We truly appreciate it. Folks, don't be alarmed. Sarah was handling our PPE and test kit request, but that will continue in Sarah's absence. And then I had another little chart I wanted to just quickly go over. Luke earlier reported that we had 18 resource requests that are currently being worked. But behind the scenes, you'll see that there are 19 that are in the creating status. That's where folks over in the health department, the EOC, development services are starting to build resource requests for additional services and whatnot. When they are able to add fidelity to that, the status changes over to draft. And we currently have 44 draft RRs sitting out there waiting for additional actions such as approval from higher authorities. So there are 22 resource requests out there that are waiting for supervisors, department heads and whatnot to review, make sure they pass the sanity check. And once they are approved, then those resource requests then change to ready for ordering status. And that's where logistics takes over and goes about to fulfill those requests. So all told, there's about 103 resource requests out there in combined across these 4 status areas. And in the end, many of these will make it into the ready for ordering and be fulfilled so that your folks across the municipality can continue to respond to COVID-19. Pending any questions, that's your logistics report for today.
Thank you, Scott. Finance.
Good morning. This is Carrie Wiedeker, the EOC's Finance Section Chief reporting. I would also actually like to express Finance's great appreciation for Sarah Rogers. She has actually done a huge amount of work for Finance and helped us manage the EOC invoices inbox. We are really going to miss her assistance. Currently, the EOC has encumbered $19,294,334. Our actual spent to date is $51,323,502 for a total of $70,617,837. Please continue submitting invoices and supporting documentation to eocinvoices@anchorageak.gov. The Office of Emergency Management does continue to seek cost recovery by way of FEMA public assistance. Aaron Zachary is the person to contact. End of report.
Thank you, Carrie. Safety.
Good morning. This is Annalisa Roberts reporting out for safety. So on the screen is a survey conducted in the UK in January of 2021 of 2,000 British adults. As you can see, the levels of stress are still pretty high among these adults. The number one cause is missing family and friends. So by getting a vaccine, you can alleviate that stress by being able to see somebody that you've been missing for the past year and a half that we've been going at this. A lot of people are also concerned about things going back to normal and feeling anxious about the changing rules surrounding lockdown. So while we're still making big strides towards the end of this pandemic, we are facing a real challenge of another pandemic surrounding mental health. In the US alone, the number of people who have thought, have contemplated suicide has risen since 2019 to 10.7%. And unfortunately, the higher respondents were 18 to 24 years old and groups of minority racial ethnic groups. So we are facing this. So if we can get a handle on this before it becomes a full-blown pandemic, we really should. So if we're the employers, if they have an employee assistance program, if you aren't working for a place that has that, maybe consider talking to somebody about getting that, or just going on your own to seeing a mental health professional just to get clarity and just kind of help yourself get through this. We are slowly making our way to the light at the end of the tunnel, but we're not quite there yet. So we just need to keep strong, hang in there, and try to protect ourselves and loved ones from a serious pandemic of the mental health. End report.
Thanks, Annalisa. Public information.
Hey, good morning, buddy. This is Kel Casey reporting out for the PIOs at the EOC. We are finalizing wording on a post about why and where to mask that's sitting on the mayor's communication director's desk, and that's getting reviewed in regards to EO 13v5. There's also AHD input that'll need to be in that. The signature pop-up is on social media, and Alaska Chip having a second company engaged in that pop-up really helps get the word out with promotion. We hear the Alaska Chip's doing a great job, and so much so that we have media interest, and there will be a tour today facilitated by one of our PIOs. We're coordinating media requests regarding the CDC decision on the Pfizer 12 plus tier. And we have a request from HD to help update the testing page. The vaccine page is now accurate, so we're going to go over the testing page and make sure it's accurate as well. We've coordinated the Hmong translated stickers and flyers. They are ready for the May 15th Veterans event, and that's to educate, encourage overcoming hesitancy, and give folks additional incentives or information. Dr. Zink requested an infographic. One of them is to your left of the screen there. That was completed by PIO Rupp, our outreach specialist. And there's two of them. They list all the upcoming Pfizer clinics. They have been distributed by different means. And I believe that they're also out on a Nixle that went out yesterday. The outreach email continues to go out daily, including the vaccine appointments, testing, and flyers. We're preparing additional data reviews for our vaccine week event so we can see really what worked best and repeat those best practices. And the interviews for the Humans of Anchorage project, which highlights the humanity of the people experiencing homelessness in the Muni, similar to what they've done in other cities, begins tomorrow, facilitated by PIO Arono. Any questions for PIO?
All right, thanks, Kale. Liaison.
Good morning. This is Celeste Prescott, Liaison Officer for the Anchorage EOC. I'd like to thank all of our partners who were able to join us today. I know Tracy with the Mat-Su Borough EOC is on with another update for us, so go ahead, Tracy.
Hi, this is Tracy with the Mat-Su Borough EOC. We're supporting public health nursing in the Mat-Su with 2 clinics this Friday at Wasilla Middle School and Sioux Valley Junior Senior High in Talkeetna. Both are Pfizer, noon to 4 p.m. Appointments are preferred and walk-ins are welcome. Wasilla can be scheduled through codevax.alaska.gov, and I'll drop the direct link for Talkeetna's appointments in the chat. Thank you, and end of report.
Thank you very much for that, Tracy. And we got good news from Mat-Su Regional today. Looks like numbers are dropping, so you guys are making some good progress out there. Do we have any other cooperators that'd like to report out at this time? Okay, hearing none, we'll go right into the hospitals. And Alaska Native Medical Center, Kirsten was unable to join us today, but they are reporting out 5 positives. 2 in the ICU, 2 on ventilators, and no PUIs. And Sean with Alaska Regional Hospital, I believe, has joined us.
I'm here. Good morning. We, let's see here. We have 7 COVID positive patients, 1 in the ICU. No, that's 7 COVID positives, 1 in the ICU, 1 PUI.
Thank you, Sean. And from Providence, Alaska Medical Center, Nikki is actually on vacation, but she was nice enough to send in her updated numbers. I just got those, and that's 7 positives, 2 in the ICU, 1 on a ventilator, and 4 recovered. And is Sergeant Perez or anyone else on with the 673rd Medical Group?
Yes, good morning. This is Sergeant Perez of the 673rd Medical Group, reporting our vaccine numbers As of yesterday, we have administered a total of 17,105 vaccines, 9,175 of those being the first dose and 7,930 being both doses. I will put these numbers in the chat pending any questions and the report.
Thank you very much for that. We appreciate it. And Matsu Regional Medical Center, I believe Kara was able to join us to report out on their drop-in numbers.
Good morning, Kara from Matsu Regional Medical Center. We currently have 7 COVID patients, with 2 of those in the ICU, none on vents, and no PUIs. Thank you.
Woohoo!
Thank you, Kara. And
Thanks,
that's
Sean.
all. For today's one. That was awesome. Thanks, guys. Have a great week.
And Amanda for command.
Hey, good morning, partners. This is Amanda Loach reporting out for the command. I have some good news and analysis to share this morning. Last night, the Anchorage Assembly passed our projected budget for operations through September 30th. We also held an internal hot wash today to talk about lessons learned from vaccine week. So to share with you guys in case you are doing vaccine operations. Big picture, through proactive facilitation of accessible vaccine administration, we were able to plateau the drop in shots administered last week. So that is a very good piece of data to report for our team and for the community. We had a total of 2,687 shots administered. And our operations team pushed out 12 extra pop-up clinics. We found that the high visibility locations helped with bringing in more traffic. Outdoors, that meant floodlights at our night events, and newer, larger signage with several banners. As well, we were able to position our teams outdoors with high traffic roads and intersections, such as those on Diamond Boulevard and at the Midtown Mall parking lot. Indoors, we found heightened success in high foot traffic areas. For example, we did a clinic at the Fifth Avenue Mall. As far as challenges go, we did have some challenges with our negotiations for facilities. That did prove time-consuming and cumbersome for our team, and we'd like to be able to be a little bit more agile when we are doing those negotiations. So that's something that we are working on improving, is just being able to negotiate facility use a little bit better. As far as public outreach goes, the level of engagement with our community continues to increase. We are working on data for that, and we will share it with you guys as soon as we have that, but we are continuing to see engagement increase as the weeks go on with our online community. What we do know is, with the support of partners like all of you, traditional partners, and those of our private industry partners and the business community, we had increased engagement online through sharing of information. So we see that as a success, at least initially, for our public outreach that we did. And like I said, we will share more information regarding the success of the public outreach. So thank you to each of you for your support through Vaccine Week and your continued work and diligence in your area of responsibility. We will see you all back here next week.
Thanks, Amanda. And any questions out there today? I didn't see any in the chat. Okay, hearing none. Our next meeting will be Monday the 17th at 10 a.m. Thanks, everybody.